Hello, everybody. Thank you very much for joining our vlog, which we intend to deal with CQC issues and the developments in recent times. So my name is Claire Chapman. I'm a partner and lead for professional discipline and regulation in the healthcare team at BLM. Adam is also a partner in the team who undertakes professional discipline and regulatory work. He also focuses on crime. We both undertake CQC work acting for providers and individual healthcare practitioners in enforcement action taken by the CQC.
Thanks, Claire. So in a moment, Claire's going to have a look at the latest report from the CQC. But before we do that, it's helpful to just look back at where we've come from since COVID arrived in March. And to remind people that from the middle of March, the CQC put all of its routine inspections on hold in order to move into effectively a crisis management phase to focus on infection prevention and control and the introductions of systems and protocols that are necessary to allow the health services to continue to provide safe care to their patients. That's been the initial focus since March, and we are now just moving into a new phase on which the CQC has recently reported.
Thanks, Adam. So on the 16th of September 2020, there was a joint statement issued by the CQC's Chief Inspectors, Deputy Chief Inspector and Lead for Mental Health Services, which outlined the approach that's going to be taken from the 6th of October. The CQC call this a transitional regulatory approach, and it's intended that will start with adult social care and dental services. The key components to that approach are going to be looking at monitoring with clear areas of focus that are going to be based on key lines of inquiry. Those key lines of inquiry are looking at safety, access to service and leadership. Information will be reviewed from all available sources, and then further information will be gathered where that's considered necessary and appropriate. CQC are hoping that their new monitoring approach will be used proportionately, and also that inspections will be implemented where there is deemed to be a greater than low risk to service users.
The notification requirements for CQC registrants remain as normal, and people should continue to report deaths and other relevant incidents in the usual way.
That's absolutely right. The usual reporting processes do certainly remain in place, and there obviously does become a risk that you will become the subject of a targeted inspection if there is considered to have been a failure to report.
Thanks, Claire. So if we then look at where the CQC are going in this next phase with their ongoing reviews, and in particular their provider collaboration reviews, which is a focus of theirs at the moment. That's designed to look at how providers are working together to deliver urgent and emergency care services in light of COVID, and to share learning to support others with the challenges of a second peak and winter pressures on the health and care system. Now, the first phase of those provider collaboration reviews has already been completed. That focused on health and social care services for the over 65s and provided some good examples of good practice which have already been published. And we're expecting to see the full findings of that review process in October. The next phase of the PCRs is going to focus on urgent and emergency care. And we're expecting to see a summary report published in December with a full national report in January of next year. We've also got the annual State of Care report expected in October, so watch out for that. And the CQC are producing regular updates on their website, which are worth keeping an eye on as and when they're produced. We'll be picking up on those on our health and care blog, and we'll give you the link to that at the end of this talk.
Thanks, Adam. I think it's clear that actually the pandemic is going to change the way in which the CQC operate and undertake their regulatory work moving forwards. And certainly one of the issues they raised in their documentation that was published on the 16th of September is that they're certainly not going to be returning to the fixed timetable of inspection or the frequency rules on inspection moving forwards. I certainly think there is more to come on this, and as Adam said, we will be publishing details on our care blog.